So today we're going to be talking about apraxia of eyelid opening. Apraxia of eyelid opening is sometimes associated with a condition that we already have covered, which is benign essential blepharospasm. So as you recall from the prior YouTube video where Misha demonstrated the blepharospasm, today we have a very special guest with us, Ashley, who's going to show us the blepharospasm. And blepharospasm is bilateral, simultaneous, it's squeezing. However, it can be associated with apraxia of eyelid opening. And so the patients both say the same thing. They're having difficulty opening their eyes. But in blepharospasm, the patients have spasm of the orbicularis that is preventing the eye from opening. And in apraxia of eyelid opening, the eyes are just passively closed. So it's almost like you're going to sleep or you're asleep, that kind of close. The lashes are not buried. So in blepharospasm, the lashes are buried because the orbicularis is firing. But in apraxia of eyelid opening, it's just lightly closed like they're asleep. And the two conditions are actually related because we have the obvious form of orbicularis-related spasm, blepharospasm, but if the pretarsal orbicularis oculi is firing, and as you know, the tarsus is in the lid, if the pretarsal orbicularis is firing, then the eye won't open because there's inhibition of the levator. And so patients with apraxia of eyelid opening say they can't open their eyes, but if they voluntarily, manually open their eyes, it might open up completely. And some patients use some type of sensory trick to get their eye open. So they might rub their forehead like this or tap themselves on the cheeks. So here we go again. Apraxia of eyelid opening. The lids are closed. She's going to use the sensory trick now to try and get her eyes to open, and miraculously the eyes pop open. And so, interestingly, the treatment of blepharospasm and apraxia of eyelid opening is botulinum toxin, but we normally would inject the botulinum toxin into the pretarsal orbicularis oculi to relieve the inhibition of the levator, and that will allow the eyes to open up. So apraxia of eyelid opening and benign essential blepharism occur in the same patient. It can also occur in other dystonias because this is a form of a focal pupil dystonia, and so the other dystonia syndromes like Parkinson's disease and progressive supranuclear palsy might also have apraxia of eyelid opening.